Most other mycotoxins have a lot of lipid solubility and a little bit of water solubility, but this one is completely fat soluble, which means bile is the way that we get it out. So this is one of the few times, if I'm seeing a high Chaetoglobosin with all the risk factors we just talked about, this is one of the few times I might go directly to a pharmaceutical bile sequestrant like colesevelam. I typically use that 2 times a day away from food and other supplements, and then I only use it for a month or less, because these binders that some of you guys are getting put on for 18 months, 2 years, 3 years, they cause massive nutrition deficiencies of fat-soluble nutrients, phosphatidylcholine, CoQ10. Phosphatidylcholine builds your cell membrane. It builds your mitochondrial membrane. If you're not nourishing that nutrient while you're on a bile sequestrant, you're going to be putting your cells into a PC or phosphatidylcholine deficiency, which makes your cells harder, and that means they're not as fluid. The cell membrane isn't as fluid, so then you can't get nutrients in and waste products out. So I don't use bile sequestrant pharmaceuticals for longer than a month typically when I use them, but this is one of the mycotoxins that I would sometimes with patients start immediately with the drug. If you can't get the drug, no problem, because there are plenty of ways to get bile sequestered or grabbed so that you don't recycle it. That's what a bile sequestrant is.